Right. So it's summer in the UAE, which means it's getting close to 40 degrees now every day. It's a little bit humid and sticky as well, though it's still a desert, but fine. And I also know in the UK and Europe, there's a bit of a heat wave happening now. So if you're sweating more than you're happy to sweat, there are treatments for excess sweating, which in medical terms is called hyperhidrosis. So excess sweating. And you can have this on your palms and soles, on your face, of course, under your arms, in the groin area, in the lower back. You can really pretty much sweat anywhere on your body where you have sweat glands, which is almost everywhere. So the treatments are pretty good that we have pretty good treatments. So just to run a few down, there's something called iontophoresis. I'm not going to really talk about that. Obviously, different kinds of deodorants can also be helpful. But there are some more. Everyone's heard of Botox for underarm sweating. Specifically, I don't inject Botox in the palms and soles because it is excruciatingly painful. So, but Botox is a brilliant treatment if you have excess underarm sweating. It's super safe. It's super effective. It's relatively cost effective, though it can be a bit pricey. Another treatment that doesn't really get talked about a lot is a treatment called oxybutynin or propantheline bromide. These are tablets you can take, and they are anticholinergic drugs. So they block the effect of the nerves that stimulate your fight or flight response. So if you think about what happens if you get stressed, anxious, very hot, stressed, you start to sweat, you can start to foam at the mouth like a dog, or you have increased saliva production. Remember the times where you took very stressful exams or you're undergoing something really stressful and you may have felt you had to pee all the time, or you may have even had loose stool. So having diarrhea, peeing, excess sweating, and foaming at the mouth or increased saliva production are all parts of your fight or flight response. A drug like propantheline bromide, known as probenthine, or oxybutynin, these are called anticholinergic drugs, and they block the effects of the nerves on these specific things. So the first thing that gets knocked off when you take a tablet like this is it reduces your sweating, which is great as a treatment for hyperhidrosis. Propantheline bromide is actually a licensed treatment for excess sweating, and it works really, really well. If you take higher doses of it, what you may experience is some dry mouth, which is the opposite of what you'd get if you were like really nervous. You can also become constipated, so you wouldn't have loose stool, you have the opposite thing, or you can have urinary retention, which means you feel like you can't pee. You do have to take a fair amount of these medications have those side effects. Like I said, the first thing that gets knocked off is the sweating, which is great, and that's why it's a licensed treatment for excess sweating. So if you sweat a lot on your face, on your palms and soles, and not just under your arms, then you probably need a treatment that's more systemic rather than just like Botox under the arms. And that's where these tablets become extremely helpful. So talk to your doctor about whether they're appropriate for you, but I think it's very good for you to know that these treatments exist so that you can look into them and you can talk to your doctor about whether they're right for you.